Just like we as individuals start the new year out with an emphasis on goal setting and determining what our priorities are going to be in our personal life, we really do the same thing at an organizational or agency level. And we here at FRC have some plans for the new year and some areas of strategic focus for us. One of those is that we want to continue to meet and exceed the ever-changing landscape of behavioral health. Certainly that is always a priority for us as an agency, but with the global pandemic, that has become even a greater priority, as we know that things continue to evolve and change, sometimes on a daily basis. And we want to continue to be able to meet the needs of the clients and the communities we serve. With that comes an ever increasing focus on how do we advance with technology. Technology for the clients we serve, technology being efficient and available for our staff at all of our locations, and how we continue to evolve to use that as efficiently as we possibly can. At FRC, we also firmly believe that when we have knowledge, we have the power and the ability to make improvements. And so another element of our focus or our goals within 2021 is to really utilize the data that we have to benefit the clients and the communities and also our staff. We want to make decisions based on that data and not maybe assumptions or lack of information, but hard data to guide us in our improvements and our services and the things that we provide to all of our communities. As we look to the new year, we also want to focus on our access to services. We know that with the pandemic, there's an ever-increasing need for individuals to have support and behavioral health care needs, and we want to improve that access. We also want to make sure that we are focusing on quality and being able to deliver best practices and the most recent information as far as service delivery to the clients that we serve in our communities. With that, we will also continue our focus on integrated healthcare as a philosophy. We know that we cannot have physical health without mental health being in good standing in each and every one of us. So that concept of focusing on the whole health of the person that we are serving will continue to be a priority for us in 2021. Additionally, we are taking advantage of some of the grant opportunities that we've had, and we as an organization will be implementing the Zero Suicide Framework. That framework is really focused on improving the quality of care that we give individuals who are struggling with suicidal thoughts, but also to focus on continually making sure our policies, our practices, our training and education for all levels of our staff are the most up-to-date and the most beneficial for meeting the needs of individuals struggling with perhaps depression and suicidal thoughts. Halfway through the year of 2020, FRC established an equity committee, and that committee is formed with representatives from all of our locations across all of our sites. And that committee is really focused and dedicated to improving training and education for the committee themselves, but also for our entire organization to identify needs and to make sure that we are providing a self-welcoming and inclusive environment for everybody that we interact with. Internally, for our staff at all levels, we will continue to focus on training and professional development. We truly believe that that is a benefit to our staff, but also to the clients they serve, so that they are equipped with the best techniques, strategies, and latest research in behavioral health. So that will continue to be a focus for us. And last but not least, certainly as we move into the next year, we will continue to focus on stewardship of the resources that we have been blessed to receive from our local communities, our state, and our federal agencies and organizations that allow FRC to provide an ever-expanding continuum of care for the communities that we serve. So best wishes to everyone on a happy, healthy 2021, and we are excited to continue to be here to meet the needs for everyone for their behavioral health care.